Trump's mental health policy, forced commitment to solve homelessness. Breaking news. President Trump aims to ease the burden on individuals with mental health conditions by offering voluntary options as part of a broader effort to reduce homelessness across the United States. This initiative is outlined in a new administration order signed Thursday. The order seeks to expand involuntary commitments by reversing judicial policies that limit the use of controversial approaches and providing support to local and state governments. It also directs agencies like the Department of Health and Human Services to audit grant recipients to prevent money from flowing to organizations opposing the administration's values. While some studies suggest involuntary commitments are already increasing, the changes would significantly boost the practice if enacted. This move aligns with the administration's goal of moving unhoused individuals off the streets into private psychiatric facilities and hospitals. Critics argue the campaign focuses on reducing public perception rather than addressing underlying issues. By removing street vendors and redirecting resources towards substance abuse programs, the administration will ensure communities remain safe and individuals receiving addiction or mental health care have access to necessary help, said White House Press Secretary Caroline Leavitt. However, many public health experts emphasize that involuntary commitment should serve as a last resort when appropriate. They argue that such measures lack sufficient evidence and may discourage seeking care. Jennifer Mathis, Deputy Director for the Bazelon Center for Mental Health Law, expressed concern, stating that overturning basic protections against arbitrary commitment is shocking and absurd in the context of federal budget cuts. The directive to agencies to seek opportunities to challenge existing protections is particularly concerning. Meanwhile, while unclear how the White House plans to implement these actions, it instructs federal agencies to combat public drug use, urban camping, and loitering. Attorney General Pam Bondi may pursue legal action against supervised drug consumption sites. Harm reduction programs will also be prioritized. A key shift would involve abandoning the housing first approach favored by the Biden administration, which has proven effective in reducing homelessness. These policies aim to decrease the level of care needed by staying off the streets. The Department of Housing and Urban Development would require organizations to collect federal health information from unhoused individuals. Some experts claim these initiatives were not developed in consultation with other officials, including public health professionals at the Substance Abuse and Mental Health Services Administration. Under the new order, to get individuals off the streets, local and state officials must prioritize outpatient treatments, despite a recent report suggesting that involuntary outpatient treatments may not have been as effective as claimed. Trump's executive order on homelessness. What you need to know. The U.S. federal government is taking a hard-line stance against homelessness, with President Donald Trump issuing an executive order demanding local officials remove unhoused individuals from streets. This move comes amid a worsening crisis in the nation's cities, where over 770,000 people experience homelessness annually, a record high. The order targets judicial precedents that limit local authorities' power to enforce mental health treatment and redirects funds toward rehabilitation programs, claiming it will restore public order. The administration argues that endemic vagrancy and disorderly behavior have made cities unsafe, citing a Supreme Court ruling that permits fines or jail time for unhoused individuals sleeping outside. This strategy follows a decades-long trend of punitive policies, including fines, arrests, and even jail sentences for encampment. Last year's Supreme Court decision, which allowed cities to penalize homeless people for sleeping outdoors, marked a pivotal shift in how governments address the issue. Critics, however, warn that such measures risk criminalizing vulnerable populations, forcing them into shelters or worse. The White House Press Secretary Caroline Leavitt framed the order as a step toward Make America Safe Again, emphasizing redirecting resources to substance abuse programs rather than punishment. The National Homelessness Law Center condemned the order, calling it a violation of basic rights and a catalyst for further displacement. Legal experts argue that such policies exacerbate the housing crisis, pushing people into tents, cars, or streets while leaving their belongings and support systems behind. The Trump administration's approach echoes rhetoric used during his campaign, which framed homelessness as a humanitarian crisis, warning of tent cities and unsafe conditions reminiscent of concentration camps. The fallout has been stark. Over 320 bills have been introduced across the U.S. to criminalize homelessness, many passing in both Democratic and Republican-led states. Advocates argue that criminalization traps individuals in cycles of poverty, debt, and instability, while others see it as a necessary measure to protect public safety. As the debate intensifies, the question remains, should public safety override human dignity, or is there a way to address homelessness without resorting to punishment?